I'm Dr. Jagadeesh PC, a senior consultant orthopedic surgeon practicing orthopedics, general orthopedics and trauma, arthroscopy and replacements, which includes the knee replacement, shoulder replacement as well as the hip replacement, and specialized in arthroscopy and sports medicine. When the knee gets sprained or injured, it is always better to rest the injured part. Any injury happens to any part has to be rested. So how to rest the part? It is always to keep the limb in elevated position, because that reduces the swelling. To take the veins out of the blood drains to the heart. And then second, ice packs. So we call it as a RICE, rice. That is rest and then elevation, compression, and whatever that is ice packs. That is has to be put around the knee joint. And in case if we have got the facility, immediately you should apply the crepe bandage around that part, not too much of tight, so that blood supply should be able to go. So apply the crepe bandage and take a rest. Avoid putting weight on the leg is very important. And once if this therapy is it, we can go to the hospital and take care of a doctor and confirm about the sprain or if any ligament is injured or not. Without that, you should not go on directly putting the weight or walking and get undue injury again without predecessors.